So today we're doing a home rehabilitation video for an individual who has a herniated disc who is not in need of surgery. So we're doing this all the rehabilitative way. So this individual is a volleyball player. He has a herniated disc on between L4 and L5. No pain with flexion, but pain with extension. So we'll be doing exercises that are strengthening the core, the glutes, the hip, and a little bit of the quad. But we're really focusing today on making sure we're stabilizing that trunk in every movement that we make, especially an individual with low back pain, because our glutes and our core and our hamstrings all protect that low back. So that's kind of what we're going to be focusing on today. So we're going to start today's home rehabilitation video with what's called diaphragmatic breathing, and it's basically breathing that helps strengthen that diaphragm, because research has stated that the diaphragm plays a big part in trunk stabilization, which is where this exercise falls is stabilization and range of motion, but more of the stabilization part. So what you'll do is you will be laying on your back, and you can grab a pillow and place it under your knees so you're nice and comfy. You're laying on your back just to take the load off that spine and get some natural traction. And take a nice big deep breath, a normal big deep breath. I'm going to put my knees up because it's just a little bit more comfortable for me. But you can grab a pillow, put your knees up, whatever helps take that load off your back. Next, I want you to grab your right hand, place it on your chest, and your left hand and place it on your belly. So diaphragmatic breathing, like I said, is the exercise of getting that diaphragm to really expand and contract while we take our big deep breaths in. So what we're going to do is we're going to inhale through our nose, and we're going to make sure we're filling that big belly, oh my gosh, filling that belly with a lot of air. And the reason why I had you place your hand on your chest and your stomach is to make sure you can feel that you're not filling your chest with air, but rather your belly. So we're taking a nice big deep breath in and filling that belly and expanding that diaphragm. And here we go, big deep breath in. Fill, 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 fill. And release. And you'll do this repetition for as long as you can, and not as long as you can, but as when you start to really feel that big expansion and feel that diaphragm expanding. I would do this at least 25 times to really get that movement down, to really train that diaphragm that you're learning to belly breathe and implementing that into your practice. So hand on chest, hand on belly, big deep breath in, fill that belly, and release. Big deep breath in, filling the belly the whole time, and we're also filling out. It's kind of like an alligator when it breathes. We're trying to get that diaphragm to contract all along here. And one more time. And I would do those repetitions at least 25 times until you get that movement down. It is a little bit weird, but that diaphragm really does help stabilize that trunk. Next, we're moving on to what's called is pelvic tilt. So we're teaching your pelvis to be in neutral, which is the prime position for any exercises that you may do, or any yard work or any laundry, anything like that. Pelvic neutral is what will help your lower back. So again, we're in the same position. We're laying on our back. I'm just going to keep my head up for a second, but you would relax back. And remember, what we're implementing is our diaphragmatic breathing, that really big belly breathing. So when we breathe in, I'm going to pull my pants up just a little, my shirt up a little bit, just so you can see my hips. And I put my hands on my hips. It kind of helps me to think about a fulcrum right under my bum. And what we're doing is we're trying to get our hips on the other side of that fulcrum. Just like that. So, remember, we're implementing, right here is our fulcrum, right here, right there. And we're trying to get our bum on the other side. Okay, so when we implement our belly breathing, or our diaphragmatic breathing, we're taking that big deep breath in, and on our release is when we'll contract that pelvis, or tilt that pelvis, excuse me. Big deep breath in, and bring that pelvis. Another way which kind of helps me think about it is we're bringing our hips towards our ribs, or even our ribs towards our hips. It really helps that contraction of your core, which is what we're utilizing when we're tilting our pelvis. So again, big deep belly breath in, and on our release, we're tilting that pelvis back into neutral. Another thing to do, especially with that exercise, is to grab a towel of some size and make that your fulcrum under your bum. If you're having a little bit of trouble trying to visualize or picture or feel that your pelvis going back and forth on a fulcrum, grabbing a dish towel or a beach towel and making it a fulcrum right under your bum, right here. Really trying to utilize that pelvic tilt, thinking of it on a fulcrum. And our next exercise is something called bridges. So for these, you will need a ball or a foam roller, and if you can get one from the athletic trainer or the physical therapist, a band that they can cut. Usually they'll give them to you if you just ask for this exercise, and there will be progressions and regressions to kind of just guide you through this. But this is another strengthening exercise for your glutes and your hamstrings. And when we add in the other tools that I told you to grab, I'll explain kind of what those help you activate as well. So we lay on our back one more time. I know it's a lot on your back, but again, like I stated before, it kind of takes the load off of your back when we're laying. So again, we're laying on our back. And remember that belly breathing that we just learned and our pelvic tilt that we just learned, they are going to be implemented in this exercise. So you see how important it is to maintain that pelvic neutral and really utilize that big belly breathing in everything you do and all your exercises. So we're going to be here, and we're going to take that nice big deep belly breath in. And when we release, we're pelvic tilting, and now we're squeezing these glutes to lift them up. Now it doesn't have to be a huge movement like this. As long, because that movement probably will hurt your back, as long as we're activating and firing these glutes. Sometimes you can even put your hands on your glutes. So again, big belly breath. Big belly breath in. And on that release, pelvic tilt and lift. So my glutes are squeezing, get me up and down. So now, you do that about, again, until you feel like those glutes are firing and you're really getting the feel of that motion. I would do at least 15. Now, if you're feeling pain, there's a regression that I believe might work. So again, we're still there, still on our back, still here, we're still here. All we're doing, again, we're still doing that big deep belly breath, but we're just activating those glutes and squeezing, holding, lifting. Releasing. Holding for 30 seconds, or if that 30 seconds is too much, 15 is great, and release. Another fact is, when we're doing our normal bridging, I forgot to mention, excuse me, I'm sorry. Big belly breath in, out, pelvic tilt, lift up. We're driving through our heels. We're not doing this. We're driving through those heels to really get that glute activated. So, and a progression to that is grabbing a foam roller or a ball and placing it between your knees. And doing this. So we're here. I have the foam roller between my knees, and I'm squeezing, really getting those adductors, the medial or inside part of your thigh to fire. And also what's firing is my abdominals. So we're gonna do the same exercise, but the whole time I'm squeezing this foam roller. I'm gonna put my hands on my glutes because that kind of helps remind me, fire those glutes. So big belly breath in, release, pelvic tilt up, and I'm squeezing. Really getting these to fire the adductors and your abdominals the whole time. I'm squeezing the whole time. You can relax a little bit when you come down, but when you come up, big belly breath in, release. You're squeezing, and down. And if these are too easy, we can move in to single leg bridge. So again, we're in this position, we're on our back, we're using our belly breathing, our pelvic tilt, and activation of our glutes. So we take that nice big belly breath in and out, and we're lifting. Now we're gonna lift up. Ooh, this one's hard. And we're gonna lift up, extending the knee, but keeping these nice and tight the entire time, and down. Now, if you start to feel a cramp in your hamstring here, move your feet a little bit closer to your bum, and it'll help take the stress off of those hamstrings and more focused on your glutes. So again, big deep breath, big belly breath in. Feel that tummy release, pelvic tilt. Now we come up. Ooh, this one's hard for me, guys. And up and down. So that would be your progressions for your bridges. Now we're moving into our next exercise, which is a little bit of muscle endurance and stability. So this next one is called a quadruped balance. So, and there are progressions to this as well. So we're coming and we're going onto all fours. We're gonna be right here just like this. Now we don't want to see you do this, right? Because one, look at my back, how there's a big dip like a camel. We don't want that. We want it nice and neutral, but look what happens when I bring my back up. My pelvis also comes into neutral. And also we want our toes nice and relaxed against the ground. So my back is nice and flat like a table, so you're stable like a table. Your hands are a little bit underneath your shoulders, a little bit in front of, no problem. And that's it. We are maintaining this position for balance and strengthening of our core. And this I would hold for 15 to 30 seconds. Really, this is really working my core. And it should for you as well. And again, for your break, don't just fall right back into that pattern. Maintain that table and come down onto your forearm. And sit back a tiny bit until you feel that nice stretch in your back. There should be no pain. And this is what's called is child's pose. It's a really good stretch for your lower back and will be implemented later as well. And then we would come right back up and get that pelvis nice and neutral by implementing that pelvic tilt that we learned and the deep belly breathing. Good. Now, a progression to this is what's just called a quadruped or a bird dog. It is a little bit challenging, so what you're going to do is you're going to we're keeping this nice pelvic neutral, we're not caving in or anything like that. If you do get a little bit tired, take a break, rest your wrists, no problem. But arms on top of shoulders, core engaged, pelvis in neutral. What we're going to do is we're going to take our left arm and our right leg and extend. But before I extend my leg, you guys remember, we want to fire that glute first. We don't want anything coming from that low back. Keep that low back nice and relaxed. I know there's a lot of things going into this exercise, but we've been doing them for a long time. For the majority of this video, we've been implementing them in every exercise. So now we're here. And again, big breath in through your nose. And we squeeze that glute up and down. A little hard for me. Come up. And we're stabilizing that core the entire time. So left arm, right leg, extend, and then flex together. Extend and flex together. Same thing with right to left. Again, making sure everything's in neutral. And then this I would suggest, honestly, just pulling up your phone or your tablet or your computer even, and just having the video on. Not taking a video of yourself, but just having the video on so you can see yourself in the monitor and make sure that you're stable as a table, your pelvis is in neutral. And you obviously can't see that my core is engaged, but engaging that core. So you're right and left. And we come up, squeeze that glute, and come back down. Another progression for that, which I don't have with me, is grabbing that band and wrapping one arm around your leg and one around your hand and one around your foot, and you're pulling it out against resistance. Ooh, relax that foot. Ooh, that makes it harder. Here we go. So that would also be stability and a lot of strength in that core and in the glutes as well. So this is another exercise that I found that's really good for range of motion and a little bit of strength. Pelvic tilt, I feel, is also a lot of range of motion because we're getting you into that pelvic neutral so that you can forward flex it, so that you can side bend. We're not going to side bend in this video, obviously, because it's a little advanced to do it on your own. But I find that range of motion is started by learning that pelvic tilt. That's why I implemented that in your range of motion feature. So we're going to do what's called four-way hip. So you're going to come and lay on your side. If this position is even too painful, stop, move on to the next exercise. But we're going to stack those hips. I put my hand on my hip, just kind of remind myself. We're going to dorsiflex the ankle. This is dorsiflexion. Going to slightly put that down behind the leg that is on the ground. Slightly behind. But we're still staying nice and stacked. We're utilizing that core, making sure our pelvis is in neutral because we were doing that the entire time. Now we see the importance of having that pelvic neutral. Slightly behind, squeezing that glute before we even think about lifting that leg. Squeeze the glute, lift. Glute is engaged the entire time. And if you need to, grab a pillow, and you can also like keep your head like this, a little bit more comfy. Squeezing the glute the entire time, slightly behind, really getting that glute to fire. The next position is on your back. Taking a deep breath in, getting that load taken off your back. We'll be dorsiflexing your ankle again like this. Taking that belly breath in and lifting. Really keeping that core nice and tight, squeezing the glute the entire time. And your quad. So remember the front part of your leg, firing that. So squeezing that to help you lift up. The next is what's called adduction. This one I don't get a whole lot of range of motion on, but again, we're having that foot in dorsiflexion just like this. And we're lifting. Making sure we're all nice and stacked, everything's nice and stable. Pelvic is in neutral, and we're lifting. And this is strengthening those adductors on the medial part of the thigh. And the last one is the one that we might feel some pain with. So if you feel pain, again, stop and move on. But if it's a little uncomfortable is okay, but we don't want any pain. Because we're feeling pain with extension, you might feel some pain with this, but try it. Painful, stop. So this is hip extension, and again, we're strengthening this glute right here without firing this low back. So this one's really important that you're making sure that you're squeezing, not your leg, sorry. Squeezing the glute. There we go. Squeeze the glute and lift. Squeeze the glute and lift. Always making sure we're firing that glute and then lifting. Firing that glute and then lifting. Perfect. So one more exercise, and then we're going to move on to the psychosocial part of your at-home rehab. So we're going to do this one standing, and these are called lateral walks. So again, we're utilizing that pelvic neutral the whole time. We're coming down into a little bit of a squat, so we do kind of have to hinge at the hip a little bit, and we're just walking laterally. Just really getting the glute to fire, the lateral leg, this side of the leg to fire, and keeping that core nice and engaged. So this is kind of what it looks like from the front. Again, we're hinging this hip a tiny bit and sitting back like we're sitting down in a chair. So you can put your hands right here just to make sure, kind of think of yourself chopping off right here, chopping yourself here, and hinging at the hip. Hinging at the hip. This could be another exercise, hip hinge. We're standing here nice and tall. Again, like I said, we're cutting ourselves in half, keeping our core engaged, hips and pelvic neutral, hinging, and hinging. And making sure there's a slight bend to the knee. We never want our legs locked out and bending like this. Knees engaged, bending at the hip, making sure you're cutting yourself off right here and hinging at that hip. Help you with those monster walks. These are the last exercise. They're strength and muscle endurance. So we're going to be here in a squat, and you're going to be walking like this. And you can even do it at an angle. Staying nice and tall the whole time. You can go backwards. Engaging those glutes the whole time, squeezing, squeezing, squeezing. I would do at least, like, find a wall to wall and at least do it 5 to 10 times, really working those quads, the glutes, the adductors, and abductors as well. So for the final portion of this video, it's kind of the psychosocial aspect. It's a little bit more of kind of just making sure, honestly, that your mind is right and that you're not beating yourself up for being injured. So what we're going to do is something a little bit different. I know it's a little bit weird, but it's worked for me in the past, so we're going to utilize that. And it's something called imagery. So what I want you to do, it's one that I really like, is you are going to write down 10 words that express your frustration, annoyance at this injury. 10 words that describe how you feel about this specific injury or how it happened, anything like that, when you write those 10 words down. After you have written those 10 words, I just want you to take a look at the page that's in front of you. Take a look at the page, really get to know where those words are, really get to feel them and embrace how they make you feel. Next, I want you to get comfy, whether it's laying on the ground, finding a stability ball and putting it under, like laying on that stability ball to get some nice traction in your spine, whatever position you're most comfortable in. And after that, I want you to close your eyes, take 3 big, deep belly breaths. Really focus on that breathing, feeling that diaphragm really expand and contract 3 times. Next, I want you to picture that page of nasty words that you wrote about being injured, about this injury that is bugging you. And I want you to pick one of those words that stood out to you the most. Next, I literally want you to imagine yourself ripping that word out of that paper and just throwing it in the garbage. Next, I want you to do the same thing to the next second word, the third word, the fourth word, ripping all those words up until there's nothing left on that paper. We have a clean slate. There's nothing in front of us. There are no negative words. There's no negative attitudes. We're starting off with a blank slate. We're starting off with positivity every day. It's a long road, but put in the work and you'll reach the end. And that completes your at-home rehabilitation video. There's one thing I mentioned kind of towards the end about a stability ball. If you have one, you don't have to go out and buy one. Laying on the ground provides perfect traction. Just starting out your exercises, first you start with diaphragmatic breathing. But before that, you could even get on that stability ball, lay on that stability ball, and really lengthen that spine and get some really good traction, or laying on the ground and just getting ready to start this rehab. Really just dialing in, taking those deep breaths, starting with that blank slate, positivity and like eagerness to succeed at this rehab. Good job.